Thank you. Thank you. A warm welcome and very good evening to all dear participants. Resource person of today's session, Dr. Nidhi Pandey ma'am. Chairperson of today's session, Dr. Manushi Srivastava ma'am. Today, we have a lecture on basic clinical pathology and microbiology. Now, I would like to introduce today's resource person, Dr. Nidhi Pandey ma'am. Ma'am is currently working as an assistant professor in the Department of Microbiology, the Rama Institute of Medical Sciences, Kanpur. She has also worked as assistant professor at United Medicity, Prayagraj. Before that, worked as a senior resident at SGPGIMS, Lucknow and the GSVM Medical College, Kanpur. Ma'am has more than 4 years of teaching experience in the field of medical microbiology and 3 years of laboratory experience. Dr. Nidhi Pandey ma'am has been invited as a delegate and presented poster in third international conference on nutraceuticals and chronic disease 2018 jointly organized by Swami Rama Himalayan University Dehradun and International Society of Nutraceuticals Chronic Disease and University of Tennessee Health Center USA. Now I would like to request Dr. Nidhi Pandey ma'am to lead today's session.
Hello.
Yes, ma'am. Yes, ma'am. Audible now.
A very good evening to Chairperson ma'am and all the participants. Today I am going to give you a brief introduction about basic clinical pathology and microbiology. Okay. First slide is all about introduction to pathology and about its subdivision. So as the name suggests, pathology stands for, basically it is a scientific study. It is a scientific study of all the structural changes that occurs in our body when we get a disease. Basically, pathos stands for suffering and logos is for study. So pathology is a scientific study of changes or suffering in the structure and function of the body in disease, and it answers the disease in terms of its etiology, pathogenesis, prognosis, and treatment. While we study a disease, there are few terminologies that we must be aware of. First is lesion. Any characteristic change that follows a disease is known as lesion. Etiology stands for the causative factor of any disease. Pathogenesis is the whole mechanism which leads to a particular lesion. Prognosis is what we can estimate about near future of in case of any disease, like what is going to happen or what is the course of the disease. Is it curable or non-curable? All these terms come under prognosis. Diagnosis is the identification of the disease. And next is treatment. How are we going to treat the disease? And prevention or prophylaxis is how to avoid the complication and spread of the disease. Next, general pathology is studied under two branches. First is histopathology and second is cytopathology. Histopathology, as the name suggests, it is the basic study of the tissues, and it includes surgical pathology, like we study removed cell or tissue by the process of biopsy. Also, it includes experimental pathology that we study in experimental animals, and forensic pathology in post-mortem studies. Next branch, cytopathology, is the study of cells that we derive from exfoliation or FNAC. Next, one more branch is hematology that solely deals with the blood and blood cells. It includes laboratory hematology and clinical hematology. Now we are going to discuss about cell injury. Basically, when our body or any cell is exposed to any form of stress, there are some changes observed in that cell. It causes cell injury. The cell injury may be reversible when the stress is in milder form, and irreversible when the injury, uh, when the exposing factor is severe. Now, the causes of cell injury are listed like hypoxia. Physical agent may be trauma or radiation. Next is chemical agents, drugs. Next comes infectious agents, immunological reactions, any genetic factor. And in last, we have nutritional imbalance. These all conditions may lead to cell injury. Now, types of cell injury. As I discussed earlier, cell injury occurs in two forms. First is reversible, when the stress the cell is exposed to is milder, and irreversible, when the stress is for prolonged duration or severe stress is present. Next, now first we'll talk about reversible cell injury. There are many changes that are observed in the particular cell. First is alteration in the plasma membrane of the cell, like we see black formation, or there is loosening of the intracellular attachment. Steatosis. Steatosis means there is accumulation of fat within the cell. Next is the changes in mitochondria, like swelling or rarefaction, or their densities seen. Amorphous densities are observed in the mitochondria. Next is nuclear change, like we see disaggregation of granular and fibrillar elements, and also we see endoplasmic reticulum changes like dilatation and detachment. Next, now we will discuss about irreversible cell injury. All those changes that are seen in reversible injuries that are seen in more severe form in irreversible cell injury mainly occurred as the result of swelling of ER, lysosome rupture, nuclear condensation, nuclear lysis, black formation in the cell membrane, mitochondrial swelling, and amorphous densities within the cell. Next, the irreversible cell injuries can be further divided into three types as described here. First is necrosis, next is apoptosis, and third is necroptosis. First, we'll talk about necrosis. It is basically death of any localized tissue following later by degradation of that tissue by the action of lysosomal enzymes, and it is basically seen in inflammation and in hypoxia. And next is apoptosis. Apoptosis is known as a coordinated or programmed cell death that mainly occurs in any pathological condition with the least possible host reaction. Now, basic difference between necrosis and apoptosis is that there is inflammation in necrosis and the surrounding tissue are also damaged. But in apoptosis, it is a basic programmed cell death of our body that is in a controlled form, and only the affected cell is removed without harming the surrounding tissues. Third one is necroptosis, that is a hybrid form of both apoptosis and necrosis, in which features of both the conditions are seen. Next. Next is changes after cell death. Once the cell is dead, what is going to happen? So first is gangrene formation occurs. Gangrene occurs as a result of necrosis, and necrosis gangrene is of further two types. First is dry gangrene and next is wet gangrene. Dry gangrene occurs in Burgess disease and Raynaud's disease, and wet gangrene occurs in bed sores and diabetic foot. Next is pathological classification. So after cell death, there may be calcification seen in the affected tissue. So it occurs as a result of calcium deposits in tissues other than enamel of tooth, and it occurs both in dead tissues and degenerated tissues. Next. Next characteristic is cellular adaptation. Once the cell is exposed to any stress, our body uh, our body manages to adapt with that stress, and it leads to fewer changes in that cell. So basically, it is a form of reversible cell injury, but the cell is not completely damaged. So we can also describe it as capability or adjusting of a cell with respect to structure and function in response to any physiological or pathological stimuli or any stress, either in mild to moderate form. It is known as cellular adaptation. Next. Now, types of cellular adaptation. First is physiological. When any stimuli, uh, it occurs in response to any stimuli and ceases once the need of adaptation has ceased. मतलब example, change in breast and uterus during pregnancy due to influence of hormones. Basically, it is for a temporary period and not for prolonged duration. When the need for adaptation is finished, the body again returns back to its original condition. Next. Next is pathological. When it occurs in response to any injury or pathogens by producing cell stress proteins, which protect from damage and help in recovery, like atrophy, hypertrophy. Atrophy is basically when we stop using any organ or any part, it reduces in size, like reduction of cell size, which result in shrinkage of cell or organ. It occurs basically due to degradation of the cellular protein by lysosomal enzyme. Example, ischemic atrophy or diffuse atrophy of muscles. Next is hypertrophy. It is opposite of atrophy. If we keep on using any particular cell for a longer duration or for prolonged duration, it leads to enlargement of that cell or organ. It occurs due to increased production of cellular protein and growth factors. Example is left ventricular hypertrophy. Next. Next is hyperplasia. Hyperplasia means increased number of cells in an organ. Number of cells gets increased, and it occurs basically due to synthesis of DNA and proliferation of cell by local production of growth factors. Example is endometrial hyperplasia and prostate hyperplasia. Next is metaplasia. Metaplasia stands for replacement of one adult type of cells with another. It occurs due to long time persist of cause lead to metaplasia by the influence of different factors like growth factors, cytokines, etc. Example is squamous metaplasia, columnar metaplasia. And one thing is to be noted, both hyperplasia and metaplasia occurs in fertile soil for the development of malignancy. Both these features can lead to malignancy in future if the particular stress that causes these changes is not removed. Next, now we'll talk about inflammation. Inflammation is basically a tissue response of any vascularized organ to the infection and damaged tissue that brings cells and molecules of host defense from the blood circulation to the site of need in order to eliminate the offending agents. Next, inflammation is divided into two types, acute and chronic. There are few differentiating features like onset. Acute inflammation is fast, it occurs within minutes to hours, and chronic inflammation is slow, like it takes days. And cellular infiltrate is mainly neutrophils in acute inflammation, while monocytes, macrophages, and lymphocytes are more prominent in chronic inflammation. Tissue injury fibrosis is usually in milder form and self-limited in acute inflammation, while it gets into severe form and progressive in case of chronic inflammation. And local and systemic signs of inflammation are more prominent in acute inflammation, while they are less prominent in chronic inflammation. Next, causes of inflammation are broadly divided into these points: physical agent, chemical agent, infective agent, foreign body, immune reaction, tissue necrosis. In physical agent, they are trauma or temperature change. Extreme temperature change can lead to inflammation. They are organic and inorganic chemical agents. Infective में they are infective etiology, bacterial agent, viral agent, fungal agent can lead to inflammation. Any foreign body injury or any immune reaction. And last is tissue necrosis. Any form of damage to tissue can lead to inflammation at that site. Next, now we'll study about mechanism of inflammation. There are various changes that are seen in inflammation or that leads to inflammation. First is the vascular change. As soon as injury occurs in our body, there is vasoconstriction for few seconds and then it converts to vasodilatation that causes excess blood flow to that required area so that blood cells can get and starts the mechanism of start fighting with that offending agent. Next is cellular change. It involves the use of polymorphonuclear cells, lymphocytes, macrophages, and other WBCs. When injury occurs, there is accumulation of these cells in the peripheral side of vessels. They move from central part of the vessel to the periphery near the basement membrane and endothelial cells by rolling, and then they slowly emigrate between the basement membrane. They are joints. They emigrate to the outer extravascular space, and there they have a fight with the infective agents, and they engulf and destroy the offending agent by means of phagocytosis. Next, this slide shows the cardinal features, 4 cardinal features of inflammation, that is redness, swelling, heat, and pain. And in scientific term, it is known as rubor, tumor, calor, and dolor. Redness occurs due to excess blood flow to that injured site. Swelling occurs due to accumulation of intravascular content to the interstitial space. Heat occurs due to change in thermoregulation as the result of any injury, and pain due to peripheral nerve irritation by the chemicals that are secreted at the site of injuries. Next, now tissue healing and repair. Healing is the process of regeneration in our body, that is replacement of dead tissue by new cells, and repair. It is basically the replacement of injured cell by fibrosis and scar tissue. These both occurs to reduce the size of damaged or necrotic areas. Most of the injuries will heal using a mixture of both mechanisms. Next. The mechanism of healing has following steps. First is the initial hemorrhage or clotting phase. As soon as the injury takes place, the wound space gets filled with the blood, which ultimately then converts into clot to stop the further bleeding. And next is inflammatory phase. It occurs within 24 hours with appearance of polymorphonuclear cells from the margin of incision by third days, and then these are replaced by macrophages. Next. Next is proliferative phase that encompasses epithelial changes. It involves formation of epithelial spur over the particular area of lesion by means of proliferating and migration of granulation tissue into type 3 collagen. And last is the maturation phase. In this, unnecessary vessels formed in the granulation tissue in the proliferative phase that are removed by apoptosis, and the type 3 collagen formed in proliferative phase gets replaced by type 1 collagen. This phase may take a year or longer, and ultimately it leads to a scar formation that is made of collagen, and a small number of fibroblasts is left. So scar tissue is formed at the site of injury. Next. Next is edema. Edema, in basic words, we can understand that abnormal accumulation of any fluid in the interstitial space leads to edema. There are broadly two divisions or two factors that causes edema at any site. Basically, increased capillary hydrostatic pressure or decreased plasma oncotic pressure, because these two pressures are the main sole points that leads to or that maintains the normal blood flow in any vessel. If there is imbalance in any of these pressures, it leads to extravasation of fluid into the interstitial space, and that causes edema or swelling of the cell. Increased capillary hydrostatic pressure can be caused by venous flow obstruction. Most prominent example is CHF, congestive heart failure, and decreased plasma-oncotic pressure, that is, it is caused by decreased protein synthesis, and it may be caused by liver disease or renal causes. Next. In this diagram, there are three conditions. First one is normal condition. A normal person is having this type of system. Next is transudate and exudate. Transudate and exudate, these both conditions have fluid outside the vessel. Basically, in normal, there is hydrostatic pressure and oncotic pressure. Hydrostatic pressure is more as compared to colloidal osmotic pressure that maintains the flow of blood within the vessel. Hydrostatic pressure is imposed by the fluid, and colloid osmotic pressure is mainly imposed by the plasma proteins that is circulated in the blood. Transudate and exudate, this is form of edema, and it occurs when there is any imbalance in both these pressures. Next. Next is shock. Shock is also commonly known as cardiovascular collapse, and basically it is caused due to reduced circulating blood volume or inadequate perfusion of cells and tissues. Either the amount of blood in the body gets reduced, or there's some problem with the perfusion of cells. The blood amount is adequate, but the cells are not adequately perfused, so it leads to a condition known as cardiovascular collapse or shock. Pathogenesis, all forms of shock involve reduced effective circulatory volume or impaired tissue oxygenation and release of inflammatory mediators. Next. Types of shock. There are broadly three types of shock. First is hypovolemic shock, next is cardiogenic shock, and third is shock associated with systemic inflammation. Hypovolemic shock, as the name suggests, it occurs due to decrease in the total volume of blood circulating in the body. It may be caused by acute hemorrhage, accident, burns, excessive use of diuretics, etc. Next is cardiogenic shock. In this case, the problem is with the heart. There are various conditions in which the heart gets affected, and there is impaired pumping of the heart. It is seen in MI, cardiac arrhythmias, or pulmonary embolism, etc. Third is shock associated with systemic inflammation. It involves septic shock and others. Septic shock is basically seen in any infective pathology. Either gram-negative or gram-positive bacterial infection leads to shock, and others include traumatic shock due to, say, severe injury, or neurogenic shock due to head injury. Next. Clinical features includes low blood pressure, low body temperature, feeble pulse, pale face, shallow respiration, and cold clammy skin. Next. Now, stages of shock. Stages of shock are divided into 3 stages. First is non-progressive stage, next is progressive stage, and third one is irreversible stage. In non-progressive stage, there is reflex compensatory mechanism that gets activated once the circulatory volume gets decreased, and this mechanism gets activated and maintain the vital perfusion so that the vital organs are not affected. Next is the progressive stage. It is characterized by tissue hypoperfusion and onset of worsening circulatory and metabolic imbalances. Third one is the irreversible stage. It takes place after the body has incurred severe cellular and tissue injury that even if hemodynamic defects are corrected, survival is impossible. Next. Next is hemorrhage. Hemorrhage means any form of blood loss from the body is known as hemorrhage. Either can take place from rupture or non-ruptured blood vessels. Types of hemorrhage include internal and external hemorrhage or can be divided into acute and chronic hemorrhage. Internal hemorrhage means bleeding within the body, and external, as the name suggests, bleeding outside of the body. Next is acute and chronic. Acute means sudden massive bleeding, and chronic means small amount of bleeding for a prolonged period of time is known as chronic hemorrhage. Next. Next is classification of hemorrhage into different classes. Hemorrhage is classified into 4 classes depending upon the amount of blood loss. So it is divided into 4 classes: class 1, class 2, class 3, and class 4. As you can see, class 1 hemorrhage involves up to 15% of the total blood volume loss, and there is no typical changes or effect on the vitals. Class 2 hemorrhage involves around 15 to 30% of total blood volume loss, and it causes tachycardia, and there is difference between systolic and diastolic blood pressure. Peripheral vasoconstriction is seen, and pale, cold, clammy skin, and blood transfusion is not usually required in this stage. Class 3 hemorrhage involves 30 to 40% of blood loss, and here blood pressures, there's drop in BP, increase in heart rate, shock, diminished capillary refill, and blood transfusion is usually necessary at this stage. Class 4 hemorrhage involves more than 40% of blood loss, and aggressive resuscitation of the person is required at this stage, and survival is difficult. Next is thrombosis or clot. Formation of any clot or mass in circulation from the blood constituents itself is known as thrombosis. Next. This diagram shows the adjoining factors that leads to thrombosis. First is the prime factor is the endothelial injury. Endothelial injury leads to hypercoagulability of the blood, and it also leads to abnormal blood flow or turbulence in the blood vessels. And this abnormal blood flow again further leads to endothelial injury, and this is ongoing process. This triangle is known as Virchow's triad of thrombosis, and there are various factors that are responsible for endothelial injury, like hypercholesterolemia, or inherited factors like factor 5 Leiden. Acquired include disseminated cancer, and abnormal blood flow and endothelial injuries are caused by stasis like atrial fibrillation and prolonged bed rest, and turbulence is caused by atherosclerosis, and that leads to vessel narrowing and turbulence in the blood vessels. Next. Type of thrombosis are these. First is venous thrombosis that occurs in deep or superficial veins, and it is most common in lower extremities. Around 90% of cases take place in lower extremities. Next, upper extremities and ovarian veins, etc. Next is arterial thrombosis. Most common sites are coronary, followed by cerebral and femoral arteries. And Effect of thrombosis, it depends upon the site where the thrombus has take place, thrombus has been formed, its size and nature of thrombi. Next. Next is embolism. It is embolism, it's the partial or complete obstruction of some part of the circulatory system by any mass. That mass is known as embolus carried in the circulation. This embolus can be generated by blood, that is thrombus as we have discussed in previous slide, or fat embolism that is generated by any fat globule, or it may be air itself that is known as air embolism. And like I have previously described, embolus is any solid, liquid or gaseous mass carried by blood to a site distant from its origin into the circulation. Next is ischemia. It is deficient blood supply to any part of tissue relative to its metabolic needs. Pathophysiology is ischemia either occurs due to hypoxia that causes low oxygen, low hemoglobin or low blood supply or leads to hypoxia. Next is malnourishment of cell, and further inadequate clearance of metabolites also lead to ischemia. Next. Types of ischemia are complete and partial. As the name suggests, complete ischemia means complete termination of blood supply, and partial ischemia means there is partial decrease in the blood supply to any cell or any tissue. Causes of ischemia include occlusion, maybe due to embolus or thrombus, trauma, and others include atherosclerosis, like deposition in the vessels that leads to narrowing of the blood vessels, and hypoglycemia. All these factors leads to decrease in the blood supply and causes ischemia. Next. Next is infarction. It is the process of tissue death that takes place as a result of ischemia to any tissue. It is known as infarction, and pathogenesis include it is the result of injury or ischemia. There will be slow death of the cell or tissue as the result of changes that take place in vascular and cellular level, and ultimately leads to irreversible form of cell injury, and that causes necrosis of the affected tissue. Causes are same as ischemia, occlusion, trauma, and atherosclerosis or hypoglycemia. Next. Next, we come to immunity. Immunity is described as the basic defense mechanism of the body or the resistance exhibited by the host against any foreign antigen, including microbes. There are two types of immunity. First is innate and next is acquired immunity. Innate immunity that we have by birth, and acquired immunity that we acquire during our lifetime. Next. Innate immunity is the resistance, as I previously described, it is the resistance by birth, which individual possesses by birth, and it is basically of different types. First is the species immunity that is seen at species level, like resistance to a pathogen shown by all members of a particular species. This type of immunity is seen in all the members of a particular species. Example, Bacillus anthracis infects human beings but not chickens. Next is racial immunity. It is seen in races. Within one species, different races may exhibit difference in resistance. Example, American Negroes are more susceptible to tuberculosis than whites. Next is individual immunity. It varies from person to person. Like example, homogeneous twins exhibit similar degree of resistance to tuberculosis. Next. Next is acquired immunity. The type of resistance which we acquire during our lifetime is known as acquired immunity. It is further divided into two types, active and passive immunity. Active immunity stands for resistance that is developed as a result of contact with an antigen, like our body is actively involved in the process of making of this type of immunity. That's why it is named as active immunity, and it occurs as a result of natural infection or by vaccination. Active immunity is further subdivided into natural immunity and artificial immunity. Natural immunity that occurs by clinical or subclinical infection, example, post exposure of smallpox infection. And artificial is induced by vaccination, that is all forms of immunity that we acquire by taking vaccine is comes under artificial immunity. Now, passive immunity, it's induced in an individual by pre-formed antibodies against infective agent or toxins. It is further divided into same natural and artificial type. Natural is through transplacental maternal antibodies that are transferred to the child. Example, transfer from mother to fetus. And artificial, this we acquire by taking anti-serum injection. Example, human anti-tetanus serum. Mechanism is by the involvement of humoral and cell-mediated immunity. Next is immune response. A specific reaction that a host or any body shows in response when an antigenic stimuli is provided to that person. It is known as immune response. And basically, immune response are of two types: humoral or antibody mediated immune response, and next is cell mediated immune response. Next, first we'll talk about humoral immune response, or it is also known as antibody mediated immune response. It is mediated by macromolecules or antibodies found in extracellular fluids, and it provides first line of defense against the most of the extracellular organisms, and it also participates in immediate hypersensitivity and certain autoimmune diseases. Like in response to antigen, foreign bodies, first B cell gets converted into plasma cell, like B cells get matured and converts into plasma cell, and then these plasma cells forms antibodies, and they help T helper cells, and both these mechanisms help in phagocytosis of the antigenic stimuli. Next is the cell mediated immune response. It is basically seen in cases of where it is seen against fungi, viruses, and intracellular bacteria. When the antigenic stimuli affects the within of the cell, then CMI gets activated, and it causes delayed hypersensitivity, and it is also seen in certain autoimmune diseases. It also provides immunity against cancer, and here the agents are phagocytes or T lymphocytes that fights against the offending agent. Next we come to autoimmune diseases. Normally, our immune system recognizes self and non-self. Basically, our own tissues are known to our immune system as self, so it does not damages our own tissue, and any foreign body or any antigen outside of the body is considered as non-self, and that's why when any foreign body invades our body, our immune system gets activated and fights against that particular agent. Autoimmunity is a condition when body produces antibodies and immunologically competent T cells against self antigens that leads to structural and functional damage to our own tissues and leads to autoimmune diseases. Our body loses the sense of self and non-self in these conditions. Next, these are classified into various types. First is hemocytolytic diseases. It involves various cells of blood circulation. In this condition, the blood cells are destroyed. Example, autoimmune hemolytic anemia, leukopenia, and thrombocytopenia. Next is localized or organ-specific diseases. In this, specific organs are the main target for the immune reactions. Example, Graves' disease, Addison's disease, pernicious anemia. Next is systemic or non-organ specific disease. In this, the autoimmunity works against a variety of self-antigen and damages several organs and tissue system at the same time. Example, rheumatoid arthritis and SLE, that stands for systemic lupus erythematosus. Next, Mechanism autoimmunity occurs either by humoral type of immune response or cellular type of immune response against the self antigen and causes type 2 and type 3 hypersensitivity reaction. Also, sometimes type 4 is seen but is rare. And the immune response can be arrested by taking immunosuppressive therapy. Next. Next is the immune deficiency diseases. These are the diseases produced when our defense mechanism is impaired. They are divided into two types, primary and secondary immune deficiency diseases. Primary immune deficiency disease are produced when abnormalities in the development of immune mechanism, when the immune cells are abnormal, and secondary immune deficiency disease takes place as a result of some disease or malnutrition or by the effect of some drugs. When the immune cells are competent, but due to the effect of some diseases, our immune system cannot work properly. These are the examples of primary immune deficiency diseases and secondary immune deficiency diseases. Primary immune deficiency diseases include humoral immune deficiencies like X-linked A gamma globulinemia. In this, gamma globulins are not formed. Next is cellular immune deficiencies like thymic hypoplasia. Next is combined immune deficiency, that is ataxia telangiectasia. Disorders of complement system like complement component and inhibitor deficiency is seen. Next is disorders of phagocytosis. In this, chronic granulomatous disease takes place. Secondary immune deficiency diseases include like lymphoid malignancy, lymphatic leukemia, AIDS, Hodgkin's lymphoma, etc. Next, next is hypersensitivity. Hypersensitivity is a condition in which our immune system result in excessive reaction. There is an exaggerated immune response to any foreign body or foreign antigen that leads to increased amount of tissue damage, disease, or even death in the sensitized host. And hypersensitivity takes place in person who have had previous contact with the particular antigen or the foreign substances. So there are two types of doses that are required to conduct hypersensitivity. First time exposure is known as priming or sensitizing dose. This is the initial contact to sensitize the immune system of the affected person by priming appropriate B or T lymphocyte. And next is shocking dose. In this, the further contact with the same antigen that causes priming causes hypersensitivity in this second time exposure, and this is known as shocking dose. Next, allergy. Allergy is the most commonly used as synonym of hypersensitivity. Allergy means an altered state of reactivity to an antigen. It may include both protective as well as injurious immune response. Now, hypersensitivity are classified into two types, immediate and delayed hypersensitivity, and it is basically classified on the time our body takes to develop the response. Next, Next is the comb gel classification of hypersensitivity. They classified hypersensitivity into four types, type 1, 2, 3, 4. First one is anaphylactic, second is cytotoxic, third is immune complex mediated, fourth is cell mediated hypersensitivity. There are few differences between these four types of hypersensitivities. First one is IgE mediated hypersensitivity. Type 2 is antibody mediated hypersensitivity. Third one is immune complex mediated hypersensitivity, and fourth is cell mediated or cytotoxic T cell mediated hypersensitivity. Next, next is neoplasm or tumor. As the name suggests, neoplasm means new form of growth. Neo means new and plasia means growth. So it is the abnormal growth of any tissue or organ that forms tumor, and the particular branch that deals with the study of neoplasm or tumor is called as oncology. There are two types of tumor, benign and malignant. Benign is non-cancerous, non-harmful, and malignant is cancerous and harmful growth. Nomenclature of the tumor is studied by adding the suffix "oma" to the particular cell type from which it originates. Example, if the tumor originates in the fibrous tissue, it is known as fibroma. If the same takes place in bone, it is known as osteoma. If it occurs from the epithelial cells, it is known as carcinoma. And likewise in mesenchymal tissue, it is known as sarcoma. Next, this table shows the basic differences between malignant and benign tumor. As we can see, benign tumor is capsulated and usually enclosed in a particular space and does not encroach in the surrounding tissue, while malignant tumor is non-capsulated and it gets easily transmitted to the surrounding organ. As the benign tumor is usually capsulated, it has slow progressive growth, but malignant tumor has rapid growth and expansile form of growth. Metastasis is absent in benign tumor but is widely present in malignant tumor. Size is usually small in benign as compared to malignant tumor. Surrounding tissues are not involved or rarely involved in benign tumor but are commonly invaded in malignant tumor. Same is with the spread. Benign does not spread to surrounding organs, but malignant one easily spread to surrounding part. Next is differentiation. Benign tumor is well differentiated, while malignant is undifferentiated type of tumor. Treatment. Benign tumor, as it is well localized and capsulated, it can be easily removed by surgery or radiation, while this form of or this mode of treatment is not effective in case of malignant tumor. So here we go for chemotherapy or radiation. Next is nutritional disorders. Nutritional disorders are caused due to deficiency of macronutrients or micronutrients. As the name suggests, macronutrients are known as macronutrients because they compose a larger quantity or larger part of our daily diet, like carbohydrates, proteins, and fats. And micronutrients are required in less amount for our bodybuilding and our health, like vitamins and minerals. Therefore, they are known as micronutrients. For the proper well-being of the body, an adequate amount of nutrients are required that provide energy to our body. And if there is increase or decrease in both the type of nutrients, it causes one or many of the conditions like diabetes, hypertension, stone formation, etc. 20%. If there is malnutrition, then there will be growth retardation or mental illness or deficiency disorders. It occurs in two forms, primary and secondary. Primary malnutrition is malnutrition due to missing of one or all component, and secondary due to malabsorption of the components. Next. This slide shows the disorders of macronutrients. Like carbohydrate, we have overweight, obesity, diabetes, cardiovascular diseases, etc. And due to deficiency, leads to mood swings, ketosis, reduced strength. Fat, we have deficiency, causes increase the risk of atherosclerosis, behavioral problems, depression, cognitive decline, etc. And in proteins, deficiency causes Kwashiorkor and marasmus. Disorders of micronutrients. This one is for vitamins. Vitamin A deficiency causes night blindness and reduced hair growth. Vitamin B1 leads to wet and dry beriberi. Vitamin B2 causes intestinal keratitis. Vitamin B3 causes pellagra. Vitamin B6 causes convulsions and anemia. Likewise, B12 causes pernicious anemia and nerve damage. Scurvy occurs due to deficiency of vitamin C, rickets, and osteoporosis. Is caused by vitamin D deficiency. Vitamin E deficiency leads to nerve abnormality, and vitamin K deficiency causes defect in the blood coagulation mechanism. Next is minerals. In this, calcium deficiency leads to osteoarthritis, and iron deficiency causes anemia, sore mouth. Iodine deficiency leads to goiter, hypothyroidism, hair loss. Potassium deficiency causes hypokalemia, that ultimately leads to muscular weakness. And in sodium, we have hyponatremia, that causes digestive disorders also. Next is the infection. Infection is the lodgement and multiplication of a parasite or infective agent in the body, and all infections do not invariably result in disease. Next is type of infection. The infection is divided into various types. First is primary infection. Like initial or first time infection to a body is known as primary infection. Secondary, when a body gets lower, or when the body resistance is lowered by a pre-existing infection and one new parasite sets up an infection in the same body, it is known as secondary infection. Cross infection is when a person is already suffering from a disease and he acquires a new infection from another source, is known as cross infection. Nosocomial infection is hospital acquired infection. Infection that we acquire while we are admitted in hospital is known as nosocomial infection. Iatrogenic infection is physician acquired or nurse induced infection as a result of drug therapy or investigating procedure. Next is subclinical infection, like the when infection in which the clinical features are not apparent. These are known as subclinical infection. Next is latent infection. In this condition, following infection, the parasite or the infective agent remain hidden or remain silent for a particular period of time, and it gets reactivated once the host immunity is decreased. This type of infection is known as latent infection. It is most commonly seen in tuberculosis. Next is atypical infection, in which the characteristic feature of that infection are not seen. And next is typical infection, in which the characteristic features of that infection are found. Next. Next is mode of transmission. Mode of transmission of infections are of different types, like contact transmission. It is seen in syphilis and AIDS. Next is inhalation, like common cold, whooping cough. Ingestion is seen in cholera, dysentery, diarrhea. Inoculation is seen in rabies virus, that is inoculated directly by the bite of rabid animals. Next is vector-borne, example flies, fleas, ticks, mites, etc. Transplacental infections are transmitted to a child through mother in utero. These are also known as teratogenic infections. Next is iatrogenic and lab acquired infection. These are acquired through injections or blood transfusions, etc. Next is type of infectious disease. Infectious disease can be of different types. First one is localized and generalized. It is basically named after the area of the affected part. If the infection is localized to a particular organ or particular site, it is known as localized infection. And if it gets transmitted to the whole body with the help of blood circulation, it comes under generalized infection. Example, bacteremia, that is circulation of bacteria in the blood. Next is septicemia. Bacteremia is only the circulation of blood in the bacteria in the blood, while septicemia occurs when that particular bacteria starts multiplying in the blood
अच्छा
circulation.
अजवाइन मंगरेल राई ये सब है
Next is pyemia. Pyemia is the pyogenic abscess as the result of septicemia that takes place in the body, or pus formation. Basically, pyemia is caused by pus formation in the body. Endemic is the disease constantly present in a particular area. Example, enteric fever or Japanese encephalitis. Next is epidemic, the disease that spreads rapidly involving many persons in a particular area at the same time. Example, meningococcal meningitis. Next is pandemic. It is an epidemic that spreads to many areas of the world or worldwide infection. Worldwide infection is known as pandemic. Example, cholera, influenza, and latest one is COVID pandemic. Next. Next slide is about classification of bacteria. Bacteria of medical importance usually measures around 2 to 5 micrometer, 2.2 to 1.5 micron in weight. Classification of bacteria is firstly done on the basis of shape. In this we have cocci, that is oval or speckled shape of bacteria. In diplococci, they are arranged in pairs. In streptococci, they are arranged in chains. Staphylococci is arranged in cluster or group. Tetrads में we have a group of 4 cocci together. Sparcina, it is group of 8 cocci. Next is bacilli, that is rod shape of bacteria. Further, we have cocobacilli. It is the intermediate shape between cocci and bacilli. Next is streptobacilli. In this, the bacilli are arranged in chains. Example, streptobacillus. Letter or cuneiform pattern. In this, the bacteria are arranged in Chinese letter form like V, Y, X at different angles to each other. Example, most common example is Corynebacterium diphtheria. Next is comma shaped or curved bacteria. Example is Vibrio. And next is spiral form of bacteria like Spirillum. Next. Also, we have spirochetes that are coiled bacteria, small hair-like structure. These are slender, like slender spiral form of bacteria like Treponema. Next is actinomycetes. These are branching filamentous structure that also resembles fungi. Next is mycoplasma, in which these are the cell wall deficient form of bacteria. And as the cell wall is deficient, these organism does not have any definite shape. And in last we have rickettsia and chlamydia. These are small obligate parasites, and these are obligate parasites and intracellular as they do not have ability to grow outside the living cells. Next classification is on based on gram staining of the bacteria. In this, we have two types of division: gram positive bacteria or gram negative bacteria. Primary identification of the bacteria is done on the basis of gram staining itself. In this, either we can get gram positive bacteria or gram negative bacteria. Gram positive bacteria stains purple color, and example is streptococcus, staphylococcus, and pneumococcus, etc. Gram negative bacteria takes pink color stain, and example is salmonella typhi, vibrio cholerae, E. coli, klebsiella, etc. Third one is based on acid fast staining. In this, either the bacteria is acid fast or non-acid fast. Acid fast bacteria take deep purple or red color. Example is Mycobacterium tuberculosis, Mycobacterium leprae, Mycobacterium avium complex, etc. Non-acid fast bacteria includes all others apart from Mycobacterium and Mycobacterium species. Next classification is based on spores. On the basis of spores, we have sporing and non-sporing bacteria. Sporing bacteria includes Bacillus and Clostridium species. Non-sporing include Streptococcus species, Staphylococcus species, etc. Next classification is based on motility. In this, we have motile bacteria and non-motile. Motile bacteria may we have Salmonella typhi, that is motile with the help of flagella. Non-motile में we have Streptococcus and Staphylococcus, etc. Next one is classification of fungi. The study of fungi basically is known as mycology. All fungi are eukaryotic organisms, and their cell wall contains chitin, mannan, and other polysaccharides. And their mode of division is asexual, sexual, or by both the processes. Next. Fungi are kept under phylum Thallophyta, and taxonomical classification is fungi are divided into either zygomycetes, ascomycetes, basidiomycetes, or deuteromycetes. This form of division is by the mode of their reproduction. Next. Next is the morphological classification of fungi. Fungi either can be yeast-like fungi, molds, and dimorphic fungi. Next, yeast are round to oval unicellular fungi that reproduce by budding. Example include most commonly Cryptococcus neoformans. Next is yeast-like fungi. These are partially grow as yeast and partially as chains in the form of elongated budding cells and that join end to end and form pseudophytes, pseudohyphae. Most common example is Candida species. Next. Next is molds. In this we have branching filaments that is known as hyphae that is of different shape and size, and hyphae may be septate or non-septate, and this form of fungi reproduce from sexual reproduction or asexual spores. Example dermatophytes or aspergillus, penicillium, etc. And last, we have dimorphic fungi. They exist in both the forms, in the yeast and in mold form. In the yeast form, they reside within the host in the yeast form, and when we culture them in the lab, it gets converted into mold form in the temperature of 22 to 25 degrees centigrade. Example is blastomyces, dermatitis, etc. Disease caused by fungi are broadly classified or broadly known as mycosis, and it is of different types like superficial mycosis that is caused on the superficial skin, subcutaneous that mainly takes place in subcutaneous tissue, and when the system is involved, it is known as systemic mycosis. Next is classification of viruses. Viruses are classified into different types based on nucleus. Based on nucleus, we have two types of viruses or two types of classification of viruses: DNA viruses and RNA viruses. Based on symmetry, we have helical virus and complex virus. Based on envelope, we have capsulated and non-capsulated virus. Next, that's all for today. Thank you.
Thank you very much, ma'am, for very informative and knowledgeable session. Now the session is open for query, and I request to all participants, if there is any query regarding the session, then please raise your hand or write your query in the chat box.
Amit, I hope there are no queries.
Again, I request to all participants, if there is any query regarding the session, then please raise your hand or write your query in the chat box. I think, ma'am, the session is very amazing, and I hope that all participants get benefited from today's session, and there is no query in the chat box. Okay. Uh, Thank you very much, ma'am, for a very knowledgeable and interactive session.
Thank you.
Now I would like to introduce today's chairperson of the session, Dr. Manasi Srivastava, ma'am. Ma'am is currently designated as professor in the Department of Community Medicine. She is a medical sociologist and has done her PhD from the renowned Banaras Hindu University, Varanasi. She is an active academician with about 4 dozen national and international papers to her credit. Ma'am has been invited as a guest speaker to Smith College, USA, to deliver a talk about the public health challenges in India. She is also invited as faculty in management institutes. Ma'am has successfully completed one major ICMR funded project as principal investigator and participated as co-investigator in various research projects. Ma'am is also nodal officer of Swachh Bharat Summer Internship Program and coordinator of Unnat Bharat Abhiyan, etc. Now, I would like to request ma'am, please conclude today's session and share her views. on today's session. Please, ma'am.
Hello, Amit. Am I audible?
Yes, ma'am. Yes, ma'am.
Okay. First of all, I wish to congratulate Dr. Nidhi for delivering such a nice, very clear, very informative uh, lecture on basic clinical pathology and microbiology. Dr. Nidhi, let me very frankly share my views on your lecture that really I get benefited. I don't know about the participants, but I get benefited. I spared time and I started listening your lecture. Of course, after 15 minutes when you started, but I came to know a lot of things. So
Thank
I
you.
personally say thanks to Dr. Nidhi for delivering such a beautiful lecture on very informative uh, concept, topic. And she tried to cover a lot of things, she discussed about various shocks and its features and different stages, progressive, non-progressive, irreversible. This is very new for me. Hemorrhage and its types, about immunity, innate and acquired immunity. Though we know something about these topics, but it is really very amazing, very informative lecture that you delivered. And I'm sure that the participants who have heard you must get benefit of this lecture. So once again, a big congratulations to Dr. Nidhi for this lecture and for the beautiful conduction of your
Thank you so much,
topic and
ma'am.
content.
That means a lot. Thank you, ma'am.
Thank you.
Thank you very much, ma'am, for your kind words about the session, and thank you again to all the participants. Now, I would like to thanks again to all the participants on behalf of Institute of Applied Statistics and the Joint State Training Center of Rajasthan. The session was totally amazing, and I hope that all participants get benefited from today's session. I again thanks to Dr. Manushi Srivastava ma'am for chairing today's session, and again thanks to all
Thank you.
participants presented here. Thank you very much.